should we place your implants above the muscle or under the muscle? Now, what muscle are we talking about? We are talking about the pectoralis major muscle, which is a very big fan-shaped muscle that is placed underneath the breast. So we have the breast on top, the pectoralis major muscle below, and then below that is the rib cage. Now, the whole idea of placing the implant under the muscle has to do with trying to provide as much of your own tissue to cover the implant, to provide as much padding as possible, so that the edges of the implant will not look so visible and the result will look more natural. So if we place the implant under the muscle, you will first have muscle covering the implant, followed by breast on top of the muscle. So it sounds like a good idea, but there is a potential problem with placing the implant completely under the muscle. Now, this muscle is very strong. So if we place the implant completely under the muscle, when you wake up from the surgery and the muscle starts to contract and tighten, there is a chance that it may gradually pull your implant out of position so that the implant ends up too high, because the direction of pull of this muscle is upwards and outwards towards the armpit. So this is a potential problem with placing the implant completely under the muscle. So what can we do to have the advantage of muscle covering the implant without the disadvantage of muscle pulling the implant out of position? So the answer is the dual plane approach. Now, in the dual plane approach, what we do is we modify the muscle by deliberately detaching it from the ribs along part of its arc of attachment to the ribs, so that the muscle cannot pull the implant out of position. Now, the extent of modification of the muscle is such that it will not affect your upper body strength. So functionally, you'll be fine and you will not feel any loss of upper body strength. But by doing this to the muscle, we can prevent it from pulling the implant out of position, which is very important because we've already talked about how important it is to have the implant in the optimal position in order to produce a good result. Now, although we modify the muscle in this way, we are still leaving a lot of it attached to the ribs, and that part of the muscle is still going to cover your implant. And it's going to cover the implant where you need it the most, and that is along the upper half of the inner margin of the breast, where most patients tend to have very thin tissues. So in that area, we still have muscle covering the implant. So by modifying the implant in this way and using the dual plane approach, we can achieve the advantage of muscle covering the implant without the disadvantage of the muscle pulling the implant out of position. Dual plane means two surgical planes, a submuscular plane under the muscle and a subglandular plane under the breast. So when we use this approach, your implant will be partly under the muscle and partly under the breast. Even though the dual plane technique requires a little bit more operating time, it is my preferred technique because of the natural results that it produces.